You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode, I spoke with Dr. Joy Tomlinson about equine liver disease. This episode of Disease Du Jour is brought to you by Bimeda. Dr. Tomlinson is an assistant professor of large animal medicine in the Department of Clinical Studies at Penn Vet's New Bolton Center. She received her degrees in biological and environmental engineering, veterinary medicine, and biomedical and biological sciences from Cornell University. Her research focuses on equine viral hepatitis, including the pathogens equine parvovirus hepatitis and equine hepacivirus. Her seminal work in this area has defined new diseases, resulting in federal regulations to prevent disease transmission. Thank you, Dr. Tomlinson, for joining us.
Of course, I'm happy to be here.
To get us started, can you explain some of the more common liver diseases in horses and what tends to cause them?
Yeah, certainly. There are quite a few causes of liver disease in horses, actually. One of the ones that we talk about frequently is toxic injury. So there are a variety of liver toxins, particularly in feed, supplement, hay, weeds in the pasture that can get in and cause just a little bit of liver damage. Sometimes, depending on the weed, it can be a much more serious problem, but often it's something you can just remove the source of the toxin and they'll recover just fine. Things that require a bit more intervention are bacterial infections of the liver, something we call cholangiohepatitis, and that can cause formation of bile stones in the liver as well. And then more recently, we've discovered that there are viral infections in the liver of horses, similar to viral hepatitis in people. And in fact, one of them is very closely related to hepatitis C virus in people. And so there's really a lot of expanding information coming out about those conditions these days. Additionally, there are a fair number that we don't really know what's causing the injury. We call it chronic active hepatitis or perhaps an immune-mediated condition, as well as the rare cancer in the liver. It's much less common in horses than other species, but it does happen. And then in really high-performing horses, we have this syndrome that we refer to as high GGT syndrome, which we think is maybe not so much an actual disease as a maladaptation to training and oxidative stress. And that's seen mostly in racehorses or other really high-performing athletes.
Okay, interesting. I'd love to jump into some of these conditions with a little bit more detail. So starting with some of these viral diseases, like equine hepacivirus and equine parvovirus hepatitis, what do we know about how they spread and why some horses get sick and others don't?
Yeah, you bring up a good point about both of these viruses, is that many horses get infected and really very few end up with significant disease. And that's a very open question, and particularly my line of research right now is why some horses get sick and others don't. When we talk about these two viruses in horse livers, equine parvovirus, or parvo for short, that tends to cause acute infections. So the horse gets infected, within a month or two, they will get sick with liver disease, and then they recover and they're fine. And for that disease, you can see these sort of outbreaks of the more severe form where a number of horses on the same farm will have severe disease at the same time. And so I suspect that there could be some sort of secondary injury to the liver, such as there's a toxin in the feed or the pasture at the same time that they're infected, and it predisposes them to more severe disease. But that's just a theory right now that I'm working on. For hepacivirus, then, that's a little bit different. That's the one that's related to hepatitis C virus in people. And infected horses can do two things. Most horses that are infected will clear the virus from their body and they'll be fine. You might be able to detect a blip in their blood work, but you'll never see clinical signs. some small proportion of horses that get infected can't clear the virus, and they stay infected for at least 6 months, likely years. And then they get this smoldering low-level inflammation in their liver that can progress to serious disease with scarring and cirrhosis and eventually liver failure. But it's both a small percent of horses that stay persistently infected and an even smaller proportion of those that develop serious disease. And we don't know what regulates which horses develop disease or not. I have some ongoing studies right now trying to look at risk factors, other immunologic factors, co-diseases that might contribute to that progression. So a lot of unanswered questions there for why certain horses get sick and others don't. In terms of how they're transmitted, there's also not a ton known about that yet. So both viruses can be transmitted in blood or other biologic products from horse to horse. So blood transfusions, plasma transfusions, antitoxins have been a source of transfer in the past. USDA licensed products now are required to test negative for parvovirus before they can be marketed. It's not a perfect test, but it has vastly reduced the amount of transmission that we've seen for parvo. Right now, hepatovirus is not regulated because when that USDA regulation went into place, we didn't know yet that hepatovirus does cause disease in horses. Other than that sort of accidental veterinarian-mediated transmission, how they transfer animal to animal in the herd is less well defined. For parvovirus, when the horse is initially infected, they can shed the virus through their nose, through their saliva, through their feces. And we have been able to infect horses by injecting virus in their nose or spraying it in their nose. So I do think there's some nose-to-nose contact or environmental contact that can spread parvovirus in horses. We don't see good evidence of shedding with hepatovirus. So I think along the same lines of blood transmission, for both viruses, probably some biting flies, horse flies, stable flies, those sorts of things might be able to transfer the virus horse to horse as well.
Okay, interesting. So I imagine biosecurity is kind of an important factor when managing some of these diseases then.
Yeah, biosecurity is a big challenge, actually. The concept of trying to prevent all biting flies would be like the holy grail for all horse owners. I think we would love that if we could, but it's so challenging, right? We do our best. Many horse owners are using fly spray, fly sheets, masks, all those things anyway, but it's not perfect. It's never going to be perfect. And then for parvovirus, we do have some recommendations for potential biosecurity during an outbreak that I've posted on the AAEP, the American Association of Equine Practitioners, has guidelines on viral hepatitis posted now that are available to veterinarians and horse owners, and has some description of how you could approach biosecurity on a farm during a parvovirus outbreak. The challenge with it, the big challenge, is that from the time a horse gets exposed to when you can detect that they have caught the virus can be at least 12 weeks.
Oh, wow.
And the horses don't show clinical signs. So they don't have a fever, they don't have nasal discharge, they don't have these other things that you use often in outbreak management to pick out the infected horses and move them into the infected group. And so what would be required for strict biosecurity would be a weekly blood test on all the negative animals. And then as soon as they come up positive, you move them out of the negative herd. And then after they come up positive, they need to be isolated for 12 to 16 weeks until they stop shedding virus. And so that the outbreak management could be 6 months of isolation of a herd with weekly blood tests. And that's just not realistic. Like I would love to say we should do that, but 90% of clients aren't going to be able to do that. So I think that's going to be a big challenge. is what do you do with these situations?
Yeah, especially when clients don't have the facilities to manage that either, let alone the weekly blood testing. It seems like it could be a big issue. Today's episode of the Disease Du Jour podcast is brought to you by Bimeda Equine. Bimeda might be the biggest animal health company you've never heard of until now. Bimeda's products have been trusted by veterinarians and owners since the 1960s when their Irish roots began. Bimeda is one of the largest producers of dewormers like Equimax, Bimectin, and Exodus. World-renowned equine athletes also rely on polyglycan, a patented formula that replaces lost or damaged synovial fluid, and Confidence EQ pheromone gel, which reduces and prevents equine stress. Consult your vet and visit bimedaus.com to see where to buy. I'd love to talk more about clinical signs. I know not every case presents with clinical signs, but in the field, what signs should veterinarians be worried about and potentially suspect a liver disease?
Fortunately or unfortunately, a lot of signs are pretty nonspecific. So lethargic, off feed, depending if it's more chronic, they may have weight loss. Some of them will have a fever depending on the underlying cause, but not always. And so those are sort of your general ill horse. You need to do a good physical exam and some baseline blood work typically. And luckily, the baseline blood work is pretty good at picking up liver disease. More specific signs that would lead you to think particularly liver include things like yellowing of the gums of the nose or inside the nostrils or the whites of the eyes, sunburn of the white areas of the horse. So it could be facial markings, a blaze, or if you have a paint horse, any of the white markings on the horse, and even white legs can show this sort of sunburned appearance that's called photodermatitis. And then when they're more severely affected and going into liver failure, you can see signs of abnormal behavior. So we would call it hepatic encephalopathy or brain disease because of the liver. And you see signs such as yawning, playing in the water bucket excessively, compulsive walking or circling, acute blindness, pressing the head into the wall, and then sometimes as well an ataxia or drunk look to their walk. They don't know where their feet are.
And then if you suspect a liver disease, what is your diagnostic procedure?
Yeah, so the most basic place to start is with your blood work. So your typical biochemistry panel and serum will give you at least an AST and GGT, and those are good enzymes that we look at to tell you about liver damage. Typically, you will follow that up if those are quite elevated with a specific liver panel that has some additional markers that can tell you more about where the liver injury or where in the liver the injury is, and give you some information on liver function and whether that is affected yet. These days, I recommend testing pretty much every case of liver disease for the liver viruses. That's a simple blood test as well. The diagnosis of these viral liver diseases is a little bit complicated because you can have so many horses that are infected and the virus isn't actively causing disease. So just having a positive viral test does not mean that is the cause of disease in that horse until you've done the additional testing and ruled out other causes, and often until you've had some serial samples over time. So for clients that are a little bit budget restricted or unsure, if you don't want to submit the viral testing right away, I do recommend that the veterinarian hold on to some serum in their freezer. So if you come back a month or two later, you can submit that old sample as well and get a timeline of results, because that can be very helpful in determining whether that virus is the cause. Then your blood work is followed up with an ultrasound of the liver. I find this very important, and often not just of the liver, but also the abdomen. And that can give you some idea if it might be this bacterial infection, if there are stones in the liver, if the size is abnormal, things that can give you a hint potentially of the cause and also the severity of disease. And then really the gold standard is a liver biopsy. And this provides the best information about both potential causes of disease and severity of disease and prognosis for recovery. And there's really no other good way for us to give you a prognosis without that biopsy. And then I find it really important to differentiate if you have a bacterial infection, that is important to know early and treat appropriately because it has a good prognosis if you treat it before there's significant scarring in the liver. So I know people are often a little bit hesitant to go ahead with the biopsy. It sounds really invasive and like a big deal, but the horses are standing, a little bit of sedation. It's just a small needle that goes through the skin into the liver, and it has a pretty low complication rate. So I'm a big fan of going ahead and getting a biopsy early so you know what you're dealing with.
Yeah, that's great advice. Is that something you can typically do in the field, or does the horse need to come into a facility?
It is something that can be done in the field, but I would say most ambulatory veterinarians aren't doing enough of them to feel comfortable with it.
Yeah.
So you'll probably get the best outcome and the best general workup if you go ahead and refer to an internal medicine specialist.
Yep, that makes sense. So once you've confirmed a diagnosis and you sort of understand the severity of the disease, what does your treatment and management strategy look like? And I know this is really going to depend on what the cause is and how severe it is, but maybe you can give us a little bit of an overview of some of the options that are available.
Yeah, so my general approach has a few aspects. So typically when I'm working up a case, I always recommend that you review the feed and environment for any potential toxins because they may be exacerbating even if they're not the primary cause. So look at all the feed, all the supplements, get rid of any supplements that are just you're not entirely sure are necessary. Check the pasture and the hay for potential contaminating weeds and toxins. And often state agricultural extension agencies will have people who can come out and look on your property for those things. So that can be really helpful. There are some sort of benign toxins like all-site clover in the pasture that they can help you identify and avoid. And then if you diagnose or suspect a bacterial infection, that treatment involves primarily antibiotics, and treatment can be prolonged. So you really should treat until the blood work is normal. Otherwise, we do see recurrence if you do too short a course of treatment. And then it can be combined with a variety of other anti-inflammatories and medications that help like wash out any stones or bile sludge from the liver. And then depending on the other causes, like for the viral infections right now, there's no direct treatment that is really established. I've had a few clients now try the human HCV antivirals in horses, and we haven't seen any side effects. We've maybe seen mild improvement, but it's ungodly expensive. It's like $100,000 for a course of treatment, and we don't really know if it's doing anything. So it's hard to say that I'm recommending that at this point, or that it's at all likely to become really feasible. But for some of the things that we suspect are an inflammatory condition, we might do a course of steroids. And then there are all sorts of nutraceuticals and supplements aimed at the liver. And my spiel on them is many of them are unlikely to be harmful, and I doubt any make a significant difference. But when you're faced with your horse has a severe disease and I'm telling you there's nothing I can say is going to work, I find most people choose to try something. And so I look for things that have like milk thistle, vitamin E, or SAM-E. Those are things that have at least some data in other species that they may be useful and are reasonable sort of supplement products to use. But I do try to stick with the bigger name supplement companies and prefer more limited ingredients. Honestly, there's been a recent paper out testing horse supplements for potentially toxic ingredients, and a huge proportion of them have toxins at detectable levels. So I get a little bit iffy on just throwing supplements at things. My theory on the big companies is that if you're seeing toxic effects, they sell to enough people, it would get heard that there's a problem with the product and it would get recalled. You can believe that theory or not, but that's where that's coming from. So yeah, and then I think there may be more use for ursodiol, which helps with bile flow, but seems like it also has some other anti-inflammatory, antioxidant effects that may be beneficial.
Okay, great. Yeah, that's great advice. What does the short and long-term prognosis look like for some of these conditions? And are there any secondary conditions that can arise from primary liver disease?
Oh, great question. Okay. So the short and long-term prognosis is all over the map. So sometimes we're finding liver disease as more of an incidental finding. You're running blood work for something else that has high liver enzymes, then you follow that down and try to figure out what's going on. And some of those horses will be fine for many years. What we look for more for a concerning prognosis or their survival is going to be limited is if they have signs of functional failure. So we see some of that on blood work, or if you have clinical signs. So if you're already having weight loss, if you're having that sunburn or photodermatitis, or any of the encephalopathic, any of the neurologic signs, that is a much poorer prognosis. And then your biopsy tells you how reversible that failure is going to be. So you can have some causes of failure that are reversible, like a severe parvovirus. If it's sort of in this middle range of severity, they can recover. But like a pyrrolysine alkaloid toxicity or long-standing cholangiohepatitis, where they have a lot of scarring in the liver, once you get to a certain point of scarring, you can't recover from that. And so that's why we do recommend doing all those diagnostics together, is to get you the most information of what the cause is and how reversible it's going to be. But that said, I have had some horses really surprise me where they'll have very bad blood work, they'll have really bad looking biopsies, and then I have followed them for years and they're doing fine. And those horses typically aren't showing very many clinical signs when we diagnose them. And so I really, at this point, go much more heavily on clinically how the horse is doing. If they're looking sick, they're probably not going to do as well long term. If they're eating well, good body condition, not showing obvious side effect or illness, then they may do fine for a long time. And then your second question about secondary conditions is a great one. So one of the functions of the liver is to clean out bacteria that might be absorbed from the GI tract. And when the liver is severely injured, that immune function is also lost, or reduced at least. And so you can see infections in other part of the horse. So you might see an unexpected pneumonia. You might see recurrent hoof abscesses or cellulitis or something where there's an infection elsewhere in the horse, and it may come back recurrently. Of course, that doesn't mean every horse that gets a foot abscess or a leg infection has liver disease.
Right.
So I don't want to scare people about that. But it just, having severe liver disease might predispose you to getting more other bacterial infections.
Yeah, that makes sense. Do you have any advice for steps veterinarians can take to reduce the risk of liver disease in their patients? I know we already talked about biosecurity earlier, but are there any other, preventative steps that they can take?
Yeah, this one's really tough. I think in many species, there are a lot of medications that doctors use that can cause toxic liver injury to horses or to the patient. We don't see that as much in horses, so there's not a ton of drugs where I'd say you need to do routine liver monitoring or anything. So we're lucky in that respect for horses. I think reviewing the possibility for toxic plants that clients should keep an eye out for, reviewing the concept of being cautious with supplements and not using too many all the time, which I know horse owners love. I'm guilty of it too. Those sort of general concepts can be useful. In terms of things that veterinarians do is typical good biosecurity practice when don't share needles between horses. If you're using equipment from one horse to the other, maybe clean it in between or disinfect it in between. And then I think one place that's not terribly well regulated now is these orthobiologic products. So if you're taking stem cell preparations, you really should use the stem cells from the horse itself or the PRP from the horse itself and not take it from one horse and give it to another horse. And then using products that are USDA licensed and therefore have been tested for the viruses can help eliminate or reduce risk as much as possible.
Right. So just like common sense, best practices for all aspects of veterinary medicine will certainly apply here.
Basically, yes. Yeah.
Great. Well, before we wrap up today, do you have any other new or ongoing research that you want to touch on or anything else that you'd like to add about liver diseases?
Yeah, I think it's so liver disease research is my focus. And so I think this is actually kind of an exciting new era for us because we've just discovered these two viruses. There's a lot more interest and recognition of what liver diseases are out there and the potential that there are more types of liver disease that we can fully characterize and potentially get treatments or interventions for. I think for a long time, what we now know are viral conditions, we used to say, I don't know what it is. Maybe it's toxic. Maybe it's immunologic. We don't have anything we can do. So now, even though I said right now we don't have a treatment for these viruses, now that we know they're there, there's opportunities. So I think we can look a couple ways. There's potential for vaccines that could prevent transmission. I think for parvovirus, that'll be very easy to create an effective vaccine. We just need buy-in from horse owners and veterinarians as to whether they recognize liver disease as a significant enough problem that they would want to add that into their vaccine group for horses. I think it's a big problem. We're trying to sort of characterize the scope of it, but it's some 15% of horses in the U.S. are infected with parvovirus, and that's quite a big proportion, right?
Yeah.
For Hepacivirus, I think vaccines might be a little bit more challenging. There's been trouble getting a vaccine for HCV for people, but the horse virus doesn't seem to mutate as rapidly, so I think it might be more achievable. And it might have positive benefits for human health. If we can get a horse vaccine to work, it might translate to human. The Hepacivirus affects almost 50% of horses in the US. So again, huge exposure rate, but the number of horses that get seriously sick is low. So I'm not sure what the uptake is there. I will say because of the human correlate, there's more movement already on the Hepacivirus vaccine front. I've got a vaccine candidate we'll be testing in the next couple of years. I know a group in Austria has a couple of vaccine candidates they've been testing. And so I think that may be a potential. And even if it's not used prophylactically for every horse, we may be able to get a therapeutic vaccine. So if you have a horse that stays persistently infected, you can vaccinate it, get it to clear that virus, and then the disease resolves. So that may be coming down the pipeline as something that will help these horses. I think there's a few new supplements that we're looking at. Nutramax has come out with a new SAMe supplement. So we're looking at whether how that's bioabsorbed and whether it's working. And then there's some potential other ones on the horizon that may help reduce that fibrosis or scarring in the liver that we're trying to develop. And then sort of the third aim I'm looking at right now as well is potential ultrasound techniques that might help us better characterize the amount of scarring and give us an idea of prognosis and progression over time without having to do repeat liver biopsies to follow that. So I've got a lot of things in the works, so it'll keep me busy for a while. But I think there's progress and hope on the horizon that we can prevent more disease and also treat more disease.
Yeah, that's really fascinating work, and it will be great to follow up with all of that research over the next few years, especially considering just how many horses are affected by these diseases, whether they're clinical or not. So,
Yeah.
really appreciate having you on today and hearing more about your work and everything that's coming down the pipeline.
Thank you. It's my pleasure.
I would like to say thank you again to Dr. Tomlinson for joining us, and thank you to Bimeda for supporting this episode. And as always, thank you to our audience for listening to Disease Du Jour. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.